We rely on hospitals to heal us, but sometimes, hospitals hide a hidden danger. We call them HAIs, or healthcare-associated infections. HAIs are infections that patients get while in a healthcare setting, like a hospital. They can be scary and even deadly. This is a big problem, especially in areas like radiology. Radiology departments are busy places. Patients come for X-rays, kinetic scans, and other important imaging tests. These tests help doctors diagnose and treat illnesses. But these areas often have lots of equipment and high-touch surfaces. This makes it easy for germs to spread. HAIs can be caused by bacteria, viruses, or fungi. They can cause a variety of illnesses from minor skin infections to serious bloodstream infections. These infections can be costly to treat and can lead to longer hospital stays. HAIs are a serious threat to patient safety. That's why it's so important for all healthcare workers, especially those in radiology, to be vigilant about infection control. We need to protect our patients and ourselves. Let's work together to create a safer healthcare environment. In the world of healthcare, we often talk about germs. Germs are tiny organisms that can cause disease. Some germs are good for us, but others can make us sick. In radiology, some germs are more common than others. We call these common pathogens. One of the most common pathogens is Staphylococcus aureus, also known as staph. Staph can live on our skin and in our noses. It can cause skin infections, pneumonia, and even bloodstream infections. Another common culprit is Escherichia coli, or E. coli. E. coli lives in our intestines. It can cause urinary tract infections, bloodstream infections, and other serious illnesses. We also worry about Clostridium difficile, or C. diff. C. diff can cause severe diarrhea and inflammation of the colon. It often spreads through contaminated surfaces and hands. Then there are viruses. The flu virus, for example, is a common cause of respiratory infections, especially during flu season. These are just a few of the many germs that can cause HAIs in radiology. By understanding these common pathogens, we can take steps to prevent their spread. Remember, knowledge is power. Think of infection spread like a chain. Each link in the chain is a step in the process. To stop the spread of infection, we need to break the chain. How does this chain work? First, there's the infectious agent. This is the germ that causes the infection. Next, there's the reservoir. The reservoir is where the germ lives and multiplies. This could be a person, an animal, or even the environment. The third link is the portal of exit. This is how the germ leaves the reservoir. For example, germs can leave the body through the nose, mouth, or a cut in the skin. Then comes the mode of transmission. This is how the germ travels from one person to another. This can happen through direct contact, like touching, or indirect contact, like touching a contaminated surface. The fifth link is the portal of entry. This is how the germ enters the body of a susceptible host. This could be through the nose, mouth, a cut in the skin, or a catheter. Lastly, we have the susceptible host. This is the person who is at risk of getting infected. Some people are more susceptible to infection than others, such as those with weakened immune systems. Breaking any link in this chain can stop the spread of infection. That's why we focus on things like hand hygiene, cleaning and disinfection, and isolation precautions. These measures help us to break the chain and protect ourselves and our patients. Section 4. The Clean Brigade Hand Hygiene and Disinfection in Radiology. Let's talk about one of the most important weapons in our fight against HI's hand hygiene. You've heard it before, but I'll say it again. Wash your hands. It sounds simple, but it's the single most effective way to prevent the spread of infection. When should you wash your hands? Before and after touching a patient, before and after handling any medical equipment, and after touching your face or any contaminated surfaces. Use soap and water and scrub for at least 20 seconds. Make sure to get under your nails and between your fingers. No time for hand washing? Use an alcohol-based hand sanitizer. It's a quick and easy way to kill germs when soap and water aren't available. But it's not just our hands that need to be clean. We also need to disinfect surfaces in the radiology department. This includes high-touch surfaces like doorknobs, bed rails, and medical equipment. Use an EPA-registered disinfectant and follow the instructions on the label. Disinfecting equipment is crucial. Think about X-ray machines, kinetic scanners, and ultrasound probes. These all come into contact with patients, so we need to make sure they're clean. Follow the manufacturer's instructions for cleaning and disinfection. Remember, a clean environment is a safer environment. Section 5. Radiology's Frontline, Empowering Staff and Patients to Combat HAIs. We're all in this together. Fighting HAIs is a team effort. Radiologic technologists are on the front lines of this battle. You are the ones interacting with patients, handling equipment, and working in the radiology department every day. You have a crucial role to play in preventing the spread of infection. First, stay up to date on infection control guidelines. The Centers for Disease Control and Prevention, or CDC, provides excellent resources. Second, be a champion for hand hygiene. Encourage your colleagues and patients to wash their hands regularly. Speak up if you see someone not following proper infection control protocols. Educate your patients about HAIs. Explain the importance of hand hygiene and other infection control measures. Encourage them to ask questions and to speak up if they have any concerns. Remember, informed patients are empowered patients. Let's not forget about our mobile devices. Our phones and computers can harbor germs too. Clean them regularly with disinfectant wipes. The same goes for portable imaging equipment. These devices travel from room to room, so it's important to keep them clean. Radiologic technologists are essential members of the healthcare team. By staying informed, practicing good hand hygiene, disinfecting equipment, and educating patients, you can make a real difference in the fight against HAIs. Let's work together to keep our patients safe.